Hello everybody.
Hey everyone.
Today Joshua and I'm going to make videos about COVID-19 vaccine experience.
So we hope you enjoy. We just want to shed a little light on a few things.
Yeah, that's good. Um, First, I would like to ask Joshua's questions like, why you decided to take the COVID-19 vaccine.
All right. Well, I know there's been a lot of opinions kind of in the media lately about the vaccine, how it works, how it affects people. I'm a healthcare worker. I work in the hospital. I'm a registered nurse. I wanted to take the vaccine because, well, to be honest with you, I was raised in a home where everyone takes vaccines. I've been taking the flu vaccine, the pneumonia vaccine. I had all my vaccines when I was a kid. Getting a vaccine was something that was never up for debate. We always just did it. I do it now because I do have a lot of older people in my family, aunts, uncles, cousins, and when I'm at home from an assignment, I'm usually around a lot of them. I'm around a lot of small children. I wanted to get it to not only protect myself, but also protect my loved ones and those close to me. I recognize that everyone has differing opinions on the vaccine. Simply sharing with you why I decided to get it. I wanted to vaccinate myself. I wanted to make sure I was safe as well as those around me. I think if you have any questions about this vaccine, or you're one of those individuals that's maybe questioning its efficacy, I highly recommend you speak to a healthcare professional, a doctor, a nurse, someone to get a little more clarification. You can read about it on the internet. If you do choose to do this, I highly recommend you get your information from a credible source. All the information that you find on the internet isn't necessarily truthful or accurate, so make sure you're using a website with a good reputation, and maybe one that has some annotations and a decent bibliography from some credible sources. I decided to get the Pfizer vaccine. It's 2 doses. I got it in a shot here in my left arm. I didn't have any real negative side effects, save for just a sore arm. So thank goodness for that. I think for many other people, that's usually the same answer they give as well. For the most part, it's just a sore arm. You might occasionally get a headache, or potentially maybe even run a little fever. That's normal. Just take some Tylenol and you should feel better very soon. So that's just been my experience. I haven't had any negative side effects. I feel perfectly fine. I myself try to stay healthy as much as I can, eating the right foods, getting plenty of rest, trying not to stress. I know it's easier said than done. Trust me, every day of your life, you're bombarded with so many different stresses in the world, whether they come from inside and they're internal or they're external stressors. So believe me, I know trying not to stress it's pretty hard, isn't it?
Oh yeah, that's right. During the pandemic, absolutely many people have stress, and try just it's hard. So tries to be relaxed and exercise, eat healthy you can. And tell me, like, for the COVID vaccine, the second dose, what difference between the first dose and second dose in your body reaction?
To be honest with you, the first dose, my arm was sore. The second dose, again, sore arm, needle going into the muscle. But with the second dose, I did develop a slight headache. I didn't get that with the first dose.
Interesting.
Again, I took some Tylenol. I was perfectly fine. And that was about as far as any negative side effects went for me.
How long is a headache for the second dose of vaccine?
It just lasted a couple of hours. I was at work and I was very busy. I didn't have a chance to just go grab something from my locker. So I got home that night, just a couple hours later, gave myself some Tylenol, took it away in a matter of minutes.
Did you, besides headache, did you have like a fever or like kind of your body kind of hot?
My arm, in particular where the injection was, but other than that, I didn't sweat or anything like that. My internal temperature felt pretty regular, nothing out of the ordinary.
That's really interesting. So for me, I also have Pfizer vaccine too. For the first dose, I have short arms and a little tired. That's it. And then second dose, I had 3 weeks after the first dose. At second dose, I didn't have headache like you had, but but my body is like, of course, have short arm too. And then at night, the night that I had the second dose, my body become hot. It's and it was hard for me to sleep at night, like hot. Um, I don't think that I had fever. It's just hot, and I didn't have headache. So it's manifest differently because you have headache, and I'm kind of like get hot in my body. But I think that's all the symptoms are just normal, and some people have very like allergic reaction to the vaccine. I mean, like in case everybody is different, so you should talk to the doctors or nurses or something like that in your hospital to make sure that the vaccine doesn't interfere with your body. And usually, I heard people say that how your body react to the annual flu shot is similar with how you respond to COVID vaccine. Is that correct?
Yes. So if you've had the flu vaccine in the past and getting the COVID vaccine, it's going to feel pretty similar if you do have any reactions. We also recommend that if you do choose to get the COVID vaccine, which I think we both actually do highly recommend, try to get it, how should I put this? If you're going to get other vaccines as well, try to space them out. You don't want to get the COVID vaccine 1 week, then decide to get the flu shot the next week, then decide to get the pneumonia shot after that. There's a lot going on with your body. You want to put a little space in between all these different vaccines. And again, try to maintain a nice, healthy state. Please, 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 no matter what, wear a mask. I just want to get on a soapbox for a minute and just say this is not a political issue. This is a health issue. Anyone in the healthcare field will tell you why masks are important. If you have it, it prevents you from spreading it. And if you don't have it, it greatly reduces the chance of you getting it. It's spread by respiratory droplets. Please wear a mask.
So I mean, like right now, not everybody have COVID vaccine yet. So that's the one way to protect yourself by wearing a mask. But like when everybody get vaccine, is fine, right? At that time. But now we have to wait until everybody get vaccinated. Is that correct?
Correct. The reason we're really pushing the vaccine is because we're trying to get what's called herd immunity, whereby if you vaccinate a large enough population, usually between, I think like 70, 80%, please don't quote me, but I think it's somewhere in that general range, then for the most part, that population is protected. That's why we really urge people to get the vaccine. Again, if you have some misgivings about it, I highly recommend you do some research. Most everyone has a phone, a cell phone or smartphone. I've got an iPhone. Literally all you have to do is just take a minute, just 60 seconds, just Google the vaccine, Google how it works with your body, Google some possible side effects you may get from it. We're here to tell you it's safe. If you are immunocompromised already, we do highly recommend that you seek your doctor or another healthcare professional and get their approval before you take the vaccine. Please do this. I know it's a hot subject. COVID it's really devastated a lot of lives. It hasn't just ruined families, it's ruined our way of life to a very, very large extent. This has not been easy on anyone, and it has affected the entire world in some way, shape, or form. Even in places now where people are beginning to recover, things are starting to get back to some form of normalcy, it has done its damage. But I think more than anything, this has definitely raised more questions about infectious disease. So I believe that after this, people will be more conscious about washing their hands, covering a cough, things like this. Things that, for the most part, we did, but now that we see how easily this stuff can spread, I think we'll be a lot more prone to making sure that we, as well as others around us, stay safe. So this has been a learning experience. It has had a lot of negativity, and it's really done a number on the world. It's been rough. It's been incredibly rough. but please don't lose hope. Things look bad, but slowly and surely we are beginning to come out of it. And hopefully to come out of it a little bit quicker, we recommend that you continue to wear the masks. We recommend that you get vaccinated. If you happen to live in a state where there is no mask mandate, I recommend maybe writing to your local politicians to hopefully try and get something in place. If you want another alternative, I recommend just wearing a mask. Just because you don't have to do it does not mean that you shouldn't do it. This virus is still around. We have, I think, 3 cures. We have Pfizer, Moderna, and I think Johnson & Johnson at the moment.
Yeah, it's a new one. Yeah,
so
it's coming.
Help is on the way. But please, until then, do yourself a favor for your loved ones, for your community, for your country. Please continue to wear this mask. It is very, very important. We want everyone to be safe. We want to get back to being able to go to restaurants and go to games and just doing things that we loved before all this happened. Things may never be quite the same, as COVID has definitely left its mark on history, but maybe we can get close, and we can start by inching closer to that by continuing to wear our masks and getting vaccinated. Again, if you want more information, look it up on the internet through a credible source, watch the news, credible news, and most importantly, go to your doctor. Talk to a doctor or a healthcare worker, because believe us, as anybody working in healthcare will tell you, this virus is real. It is not fake. We have both had several patients that have died from it. It is real.
Yeah.
Okay, and even though we have a cure, it's going to be here for a while. So please, 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 to mitigate a lot of the negative side effects.
Yeah.
Stay healthy.
Okay.
All right.
Thank you.
So thank you all.
Yes.
Sorry, Anna. I think I did more of the talking than I was supposed to.
No, it's okay. You did a great job.
Thank you guys for listening. Thank you for being safe. God bless your families. God bless America. And hopefully we'll see you again in the next video.
Okay, thank you.